Hello everyone. Welcome back Easy Nurse Education YouTube channel. Today we'll be talking about dementia, a condition that affects millions worldwide. Under the topic of dementia, you can learn about its definition, types, risk factors and causes, symptoms, diagnosis, treatments, and nursing care plans. Definition of dementia. Dementia is not a single disease, but a group of symptoms that affect memory, thinking, behavior, and daily functioning.
Types of dementia. 1. Alzheimer's disease. 2. Vascular dementia. 3. Lewy body dementia. 4. Frontotemporal dementia. FTD. 5. Mixed dementia.
Alzheimer's disease. Its most common type of dementia, caused by abnormal protein deposits in the brain, amyloid plaques and tau tangles. Symptoms are memory loss, difficulty planning or solving problems, confusion with time, place, changes in mood. Vascular dementia. It's caused by reduced blood flow to the brain, often after a stroke or series of small strokes. Symptoms are impaired judgment, difficulty with attention and planning, slowed thinking, sometimes memory loss. Lewy body dementia. It caused by abnormal protein deposits, Lewy bodies, in the brain. Symptoms: visual hallucinations, fluctuating attention, Parkinsonism, shaky movement, sleep disturbances. Frontotemporal dementia, FTD. It caused by degeneration of the frontal and/or temporal lobes of the brain. Symptoms: personality and behavior changes, language difficulties, sometimes impaired judgment. Mixed dementia. It combination of two or more types, often Alzheimer's and vascular dementia. Symptoms: features of both types depending on which brain regions are affected. Risk factors and causes. Causes: Alzheimer's disease, vascular change in brain, stroke, Parkinson disease, head injury. Risk factors: age. Risk rises sharply after age 65. Family history and genetics. Having a parent or sibling with dementia increases risk. Medical conditions: hypertension, diabetes, high cholesterol, obesity, stroke. Lifestyle factors: smoking, excessive alcohol intake, poor diet, physical inactivity. Low cognitive and social activity, less mental stimulation and social isolation. Head trauma, repeated brain injuries raise the risk. Gender: women are slightly more likely to develop Alzheimer's dementia. Medical history: onset and progression of symptoms, memory loss, confusion, behavior changes, family history of dementia or neurological disorders, review of medications, lifestyle factors, alcohol use, depression, or head injuries. Physical and neurological examination, general health check, blood pressure, cardiovascular status, thyroid, vitamin deficiencies. Neurological exam, reflexes, coordination, balance, eye movements, speech. Cognitive and mental status testing, mini mental state examination, MMSE. Montreal Cognitive Assessment, MOCA. Clock drawing, word recall, problem-solving tasks. These measure memory, orientation, attention, language, and executive function. Laboratory tests, blood tests to rule out reversible causes, thyroid function, hypothyroidism, vitamin B12 and folate deficiency. Infections, example, syphilis and HIV, electrolytes, liver, and kidney function. Brain imaging, CT scan, MRI, to detect strokes, tumors, hydrocephalus, or atrophy. PET scan, FDG PET or amyloid PET, may be used in specialized centers for early Alzheimer's detection. Psychiatric assessment, to distinguish dementia from depression, delirium, or other psychiatric illnesses. Functional assessment, ability to perform daily activities, eating, dressing, managing finances. Treatments, unfortunately, there is no complete cure for dementia, but treatments can improve quality of life. There are two types: pharmacological and non-pharmacological. Pharmacological treatments, cholinesterase inhibitors, donepezil, rivastigmine, galantamine. Improve memory and daily functioning in mild to moderate dementia, NMDA receptor antagonist. Memantine regulates glutamate activity, protects neurons. Antidepressants, SSRIs like sertraline, citalopram, for depression, anxiety, or irritability. Antipsychotics, risperidone, quetiapine, olanzapine, for severe agitation, hallucinations, or aggression. Anxiolytics, short-acting benzodiazepines, buspirone, for acute anxiety or agitation, with caution. Hypnotics, example, melatonin, zolpidem, for sleep disturbances, mood stabilizers, valproate, carbamazepine, sometimes used for behavioral symptoms, but evidence is limited. Non-pharmacological management for dementia, cognitive and functional support, behavioral and psychological support, lifestyle and environmental measures, family and caregiver support, cognitive and functional support, cognitive stimulation therapy, puzzles, memory games, reminiscence therapy, orientation aids, calendars, clocks, labels, reminders, occupational therapy for daily living activities, behavioral and psychological support, music, art, or pet therapy to reduce agitation and improve mood, structured routines to minimize confusion, validation therapy and supportive communication. Lifestyle and environmental measures, safe, calm, well-lit living environment to prevent accidents, regular physical exercise to maintain mobility and slow decline, balanced diet and hydration, sleep hygiene practices. Nursing care plan. Thanks for watching this video. If you found this video useful, share it with others, and subscribe for more nursing and health-related topics.